Bedlam Hospital, London, 1403. A woman sat naked in a stone cell covered in her own filth. She hadn't spoken in 3 days, just rocked back and forth, humming a tuneless melody. The physician entered with a basket. Inside, 50 live leeches writhed over each other, slick and black. He smiled. "We'll drain the darkness from your blood," he said softly. "Then you'll be sane again." She didn't respond, didn't look at him. So he began placing leeches on her temples, one by one. They latched on immediately. Hungry, she didn't even flinch. "Before we continue, let me ask you something. If someone told you they could cure mental illness by draining your blood with parasites, would you believe them? Drop your answer below, because hundreds of thousands of people did, for over 1,000 years. And the doctors? They were absolutely certain it worked. Medieval medicine wasn't medicine, not in any sense we'd recognize. It was philosophy dressed in blood. A system of belief so confident, so elaborate, so completely wrong that it survived for centuries, despite killing more people than it saved. And at the center of this system was one simple idea. Your body contained 4 fluids, 4 humors: blood, phlegm, yellow bile, black bile. And if these fluids fell out of balance, you got sick. Physically sick, mentally sick, didn't matter. The solution was always the same: drain the excess, restore the balance, make the patient whole again. This wasn't superstition. This was science. Greek science, Hippocratic science, the kind taught in universities, written in textbooks, practiced by the most educated men in Europe. They believed it the way we believe in antibiotics, with absolute certainty, with institutional backing, with centuries of tradition reinforcing every assumption. And when it came to madness, to insanity, to what we'd now call mental illness, the diagnosis was clear. Too much blood in the brain, hot blood, corrupted blood, blood thick with melancholy and darkness. The treatment? Obvious. Remove the blood, let the leeches feed. Let's go back to that woman. Her name was Catherine, 26 years old, married, mother of 2. She'd been normal once, happy even. But then her 3rd child was stillborn, came out blue, silent, perfect, and dead. Something broke in Catherine after that. She stopped speaking, stopped eating, stopped acknowledging her family, would sit for hours staring at nothing. Sometimes she'd laugh, wild, inappropriate laughter at moments of silence. Other times she'd weep, but mostly she just sat, empty, gone. Her husband tried everything: prayer, priests, exorcisms. Nothing worked. So he brought her to Bedlam, to the physicians, to men who claimed they could cure anything if you paid them enough. The physician's name was Dr. Edmund Blackwell, 43 years old, university trained, Bologna, Paris, Prague. He'd studied under the best medical minds in Europe, read Galen and Avicenna in the original Latin and Arabic. He knew medicine, knew it the way medieval men knew anything, through texts, through authority, through inherited wisdom that went back to ancient Greece and was therefore assumed to be true. He examined Catherine with practiced efficiency, checked her pulse, examined her tongue, smelled her breath, pressed his fingers against her temples. Then he nodded. Diagnosis confirmed. "Excessive melancholic humor," he announced to the attendants. "Black bile has flooded the ventricles of her brain. The darkness has displaced her reason. We must drain it, aggressively." The attendants nodded. They'd heard this before, seen this before, done this before, hundreds of times. Melancholy was common, especially in women, especially after childbirth. The treatment was standard: leeches, lots of them, applied to the head, near the brain. Let them feed until the patient fainted from blood loss. Then wait. See if sanity returned with consciousness. Sometimes it did, usually it didn't. But when it worked, it was proof the theory was correct. When it failed, well, the patient simply had too much corruption, too much darkness, beyond medical help. A spiritual problem, not the doctor's fault. Dr. Blackwell opened his basket. The leeches were Hirudo medicinalis, medical leeches, bred specifically for this purpose. Fat, healthy, starving. A hungry leech could drink 5 times its body weight in blood, could feed for 30 minutes before becoming too engorged to hold on, could drain half a pint from a single attachment site. 50 leeches? That was 2 to 3 pints, maybe more. Enough to make a healthy person dizzy, enough to make a sick person unconscious, enough to kill someone who was already weak. But that was the point. Push the body to the edge, let it choose between madness and death, see which one it held on to stronger. He started with Catherine's temples, 1 leech on each side, right over the temporal arteries. The leeches attached instantly, their 3-jawed mouths cutting through skin with tiny serrated teeth, Y-shaped wounds that bled freely. Catherine didn't react, didn't even blink. Dr. Blackwell took that as a good sign. The madness was deep, profound. She was too far gone to feel pain. That meant the treatment was definitely needed. He added more leeches: forehead, crown of the head, behind the ears, base of the skull. Each leech finding purchase, latching on, beginning to feed, their bodies pulsing, swelling, turning from black to dark red as they filled with Catherine's blood. Within 5 minutes, she had 20 leeches on her head. Within 10, 40. Dr. Blackwell used all 50, placed the last few on her neck, over the jugular. Maximum drainage, maximum effect. Now came the waiting. Leeches fed slowly, methodically, couldn't be rushed. So Dr. Blackwell sat on a stool and watched, made notes on a wax tablet, described the patient's condition, her lack of response, the good color of her blood, red and healthy, not black, not corrupted, which was confusing. The theory said melancholy came from black bile, from darkness in the blood, but Catherine's blood looked normal. Dr. Blackwell frowned, made a note to think about this later. Maybe the darkness was deeper, hidden in the organs, invisible to the eye but present nonetheless. Yes, that must be it. The theory was sound. The observation was simply incomplete. Catherine began to sway. 15 minutes in, eyes unfocused, skin pale. The leeches were working, draining the heat, the excess, the corruption. Her head tilted forward, leeches still attached, still feeding, little dark lumps covering her skull like grotesque decoration. Blood ran down her face, down her neck, soaked into her hair, dripped onto her chest. The attendants watched impassively. They'd seen worse, much worse. This was gentle, clinical, professional. No screaming, no struggling. Just a woman slowly being drained while 50 parasites gorged themselves on her life. 20 minutes. Catherine slumped, fell sideways, hit the stone floor with a wet thud. Several leeches detached from the impact, rolled away, fat and sluggish, too full to move properly. Dr. Blackwell stood, checked her pulse. Weak, thready, perfect. He gestured to the attendants. Remove the rest. The treatment is complete. The attendants pulled the leeches off one by one. Each removal left a bleeding wound, Y-shaped, open, flowing. Leeches inject an anticoagulant when they feed. Hirudin prevents blood from clotting while they eat. Also prevents it from clotting after they're removed. Catherine had 50 leech wounds on her head and neck, all bleeding freely, all refusing to stop. Blood pooled around her head, spread across the stone, soaked into the straw bedding. She lay unconscious, barely breathing, lips blue, face the color of old parchment. Dr. Blackwell nodded approvingly. Excellent. The humors are draining. When she wakes, the madness will have gone with them. He left instructions with the attendants. Keep her warm. Give her water if she wakes. Send word immediately if she speaks. Then he moved to the next patient, the next treatment, the next application of medical science. Catherine didn't wake up for 6 hours. When she did, she was weaker than before, could barely lift her head, couldn't sit up. The bleeding had finally stopped, but the damage was done. 3 pints of blood, gone, fed to parasites, drained onto stone floors, lost. Her body went into shock trying to compensate, heart racing, breathing shallow, skin cold, clammy. She still didn't speak, still didn't acknowledge her surroundings, still rocked and hummed when she had the strength. The madness hadn't left. The treatment had failed. Dr. Blackwell returned the next day, examined her, frowned. The corruption runs deeper than anticipated, he announced. We'll need a second treatment, more aggressive, more thorough. The attendants prepared another basket of leeches. Catherine was too weak to resist, too weak to understand, too weak to be afraid. They applied 60 leeches this time, covered her entire head, her neck, her shoulders, drained another 2 pints, maybe more. She lost consciousness within 10 minutes, didn't wake up for a full day. The second treatment failed too. Catherine remained mad, remained empty, remained lost inside herself. But now she was also dying, couldn't eat, couldn't drink, couldn't stand. The blood loss had been too severe. Her body couldn't recover. Dr. Blackwell prescribed tonics, herbal mixtures, red wine to rebuild the blood, but it was too late. Catherine's organs were failing, shutting down one by one. She died on the 5th day, quietly, without ceremony, without ever speaking again, without ever coming back. Dr. Blackwell recorded her death with clinical detachment. Patient succumbed to an overabundance of melancholic humor. Treatment was administered correctly, but the corruption was too advanced. Cause of death, natural progression of madness, not blood loss, not medical malpractice, not 50 leeches draining the life from a grieving mother who needed compassion, not parasites, just madness, natural, unavoidable, beyond medicine's ability to heal. He moved on to the next patient. The theory remained intact, but Catherine wasn't unique, wasn't even unusual. This happened constantly, daily, across Europe, for centuries. People brought to physicians, people suffering from what we'd now recognize as depression, psychosis, schizophrenia, PTSD, bipolar disorder, grief, trauma. Every condition of the mind was reduced to one diagnosis, humoral imbalance, and every diagnosis had one treatment: drain the blood, balance the humors, cure the madness. Let me tell you about another patient. Thomas, 34 years old, a merchant, successful, wealthy, started hearing voices after a fever, not all the time, just occasionally, whispers, accusations, telling him his business partners were plotting against him, telling him his wife was unfaithful, telling him to hurt himself before they hurt him. He ignored them at first, thought they'd go away, but they got louder, more insistent, more detailed. He started acting on them, accused his partners publicly, beat a servant he thought was spying, tried to stab his wife during dinner. His family had him committed, brought him to the physicians, to the experts in madness. The diagnosis was quick: excess blood, hot blood, rushing to the brain, creating pressure, generating false perceptions. The voices weren't real, weren't demons, weren't possession. They were medical, physiological, caused by too much blood pressing on the brain. The solution? Bloodletting. Aggressive bloodletting, not just leeches, venesection, opening a vein and letting blood pour out until the patient fainted. They started with his arm, a deep cut across the median cubital vein. Blood sprayed, poured, filled a basin, 1 pint, 2 pints. Thomas stayed conscious, still heard the voices, still looked around frantically, convinced people were hiding in the corners. The physician went deeper, opened a second vein, let both bleed simultaneously. 3 pints, 4 pints. Thomas started to fade, eyes rolling back, body going limp, but he was still muttering, still responding to voices only he could hear, so they kept bleeding him. 5 pints, 6 pints, nearly half his total blood volume. Thomas passed out. They let the bleeding continue for another minute, just to be sure. Then they bound the wounds, waited, watched. He woke up hours later, confused, disoriented, pale as death, but quiet. The voices had stopped. The physician called it a success, proof the treatment worked. Thomas was cured. They sent him home 3 days later, told his family the madness had been drained away, that he was healthy now, normal, safe. The voices came back within a week, louder than before, more violent. Thomas killed his wife with a kitchen knife, claimed the voices told him she was a demon, that she'd been replaced, that the real woman was trapped somewhere, and this creature had taken her place. He was subdued by neighbors. Brought back to the physicians, they bled him again. Same process, same volume, same temporary silence, same eventual return. Third time, they added leeches, covered his entire head, drained blood from above and below, from arteries and veins. Thomas survived the treatment but lost his mind completely, stopped speaking, stopped eating, died of starvation in a cell. The physicians noted his case in their records. Incurable madness. Bloodletting provided temporary relief, but ultimate cure was beyond medical capacity. Not their fault, not their failure, just an exceptionally difficult case. This was the pattern: patient presence with madness, physician diagnoses humoral imbalance, treatment involves draining blood, patient either dies from blood loss or survives but remains mad. Physician blames the disease, not the treatment, records the case as evidence that some madness is simply too severe to cure. The theory remains unchallenged. The practice continues. More patients, more leeches, more blood, more death, all in the name of medicine. But let's be clear about what was actually happening here. These weren't stupid people. Medieval physicians were educated, trained, committed to their craft. They genuinely believed they were healing, saving lives, fighting disease with the tools they had. The problem wasn't lack of intelligence, it was lack of scientific method, lack of controlled observation, lack of willingness to question authority. They had a theory, a beautiful, elegant theory that explained everything. The 4 humors: perfect balance creating perfect health, any imbalance creating disease, physical or mental, didn't matter. Same cause, same cure, drain the excess, restore the balance. And when the treatment failed, well, that wasn't evidence the theory was wrong. That was evidence the patient was too far gone, the corruption too deep, the imbalance too extreme. The physician had done everything right, applied the treatment correctly, followed the texts, honored the ancient wisdom, If it didn't work, the fault lay with the disease, with the patient's constitution, with God's will, never with the theory, never with the treatment. The theory was Greek, classical, time-tested. How could it be wrong? This is the danger of unfalsifiable beliefs, of systems that interpret every result as confirmation. If the patient recovers, the treatment worked. If the patient dies, the disease was too severe. Either way, the theory is correct. The physician is blameless. The practice continues, and people keep dying, keep suffering, keep being subjected to treatments that harm more than they heal. But the doctors sleep well, convinced they're heroes, healers, men of science fighting against the darkness of disease and madness. Let me give you another example. A young woman, Margaret, 19 years old, started having visions after a religious revival, saw angels, saw demons, spoke in tongues, claimed to receive messages from God. Her family thought she was blessed, touched by the divine. But when she started prophesying doom, predicting deaths, accusing townspeople of witchcraft, when her visions became disruptive, dangerous, socially unacceptable, they changed their minds, brought her to the physicians, to men who could cure religious mania with medical precision. The diagnosis was interesting. Not excess blood, excess heat, hot humors creating spiritual delusions, the brain overheating, producing false images, false beliefs. The treatment? Leeches, but also cooling. Margaret was placed in a cold bath, ice water, forced to sit in it for hours while leeches fed from her temples and neck. The theory was that the cold would draw heat from her core, the leeches would drain the hot blood. Together, they'd cool her brain, stop the visions, restore sanity. Margaret screamed, begged, thrashed in the ice bath while leeches sucked her blood. She was held down by attendants, strong men who didn't care about her pleas, who believed they were helping, who'd been told this was necessary, painful but necessary, cruel but kind. The screaming meant the treatment was working, the heat was being driven out, the madness was leaving. If she stopped screaming, that would be bad. That would mean she'd given up, given in, let the madness win. So they wanted her to scream, needed her to fight, took her resistance as proof of effectiveness. 2 hours in the ice bath, leeches feeding the entire time. Margaret went silent, not because the visions stopped, because she lost consciousness, hypothermia, blood loss, shock. Her body shut down trying to survive. They pulled her out, dried her off, wrapped her in blankets, waited for her to wake up. She didn't, not for 16 hours. When she finally came to, she was delirious, feverish, pneumonia. The ice bath had worked too well, cooled her too much, made her sick. But the visions, still there, still vivid, still consuming her mind. The physician tried again, 3rd time, 4th time, each treatment more aggressive, more leeches, colder water, longer sessions. Margaret's body couldn't take it. She developed infections, anemia, chronic hypothermia, lost weight, lost strength, lost the will to resist. By the 6th treatment, she didn't scream anymore, didn't fight, just sat in the ice water, staring at nothing, letting the leeches feed, letting the cold consume her. She died during the 7th treatment. Heart stopped, body gave out. Too much damage, too much trauma, too much faith in a theory that was fundamentally wrong. The physician recorded her death as a victory. Patient's religious mania was successfully suppressed. Visions ceased. Unfortunately, the patient's constitution was too weak to survive the necessary treatments. Death occurred, but madness was defeated, as if madness and life were separate, as if you could kill one without killing the other, as if draining a teenage girl's blood while freezing her in ice water was medicine, healing, progress. He was proud of his work, believed he'd done everything possible, that Margaret's death was unfortunate but not his fault. The disease was too severe, the madness too deep. He'd fought bravely, used every tool at his disposal, honored the ancient wisdom. What more could be expected? This is what makes medieval medicine so horrifying. Not just the treatments, but the confidence, the certainty, the absolute conviction that they were right. These physicians weren't monsters. They were believers, true believers in a system that made perfect sense within its own logic. Blood caused disease. Draining blood cured disease. Madness was just another disease, another imbalance, another condition that could be corrected with the right amount of blood loss. It was elegant, simple, universal, and completely catastrophically wrong. But how could they know? They had no microscopes, no understanding of bacteria, no concept of mental illness as a separate category from physical illness, no psychiatric medications, no therapy, no neuroscience. All they had was observation, and the observations seemed to support their theory. Sometimes patients got better after bloodletting, not often, not reliably, but sometimes. And in medicine, sometimes is enough to justify anything, enough to keep a practice alive for centuries, enough to kill thousands while claiming to heal them. Let's talk about the success cases, because there were some, people who were bled and actually improved. How? Why? Simple. Placebo effect. Regression to the mean. Natural recovery. Madness isn't constant. Depression lifts. Psychosis waxes and wanes. Trauma symptoms fluctuate. If you bleed someone during a bad episode and they happen to improve during a natural upswing, you'll credit the treatment. Confirmation bias. The physician remembers the successes, forgets the failures, tells stories about the woman who stopped hearing voices after leeches, doesn't mention the dozen who died, doesn't count the hundreds who stayed mad, focuses on the anomalies, the miracles, the cases that prove the theory, and patients believed too, wanted to believe, needed to believe, because the alternative was accepting that madness was incurable, that their loved ones were lost forever, that nothing could be done. Better to try something, anything, even if it meant leeches, even if it meant blood loss, even if it meant pain. Hope is powerful, desperate hope even more so. Families paid fortunes for leech treatments, brought their mad relatives to physicians again and again, each failure explained away, each death rationalized. Each moment of false hope stretched into justification for the next attempt. One man brought his son 7 times. The boy was 12, had seizures, called epilepsy, but probably something neurological, brain tumor maybe, or stroke damage, something structural, physical, not curable by any medieval treatment, but the father believed. The first 6 treatments failed. The boy kept seizing, kept losing consciousness, kept suffering. But the 7th time, the seizures stopped for 3 days. Just 3 days. Then they came back worse than ever. But those 3 days were enough. Proof the treatment worked. Proof the physicians knew what they were doing. The father told everyone, praised the doctors, recommended them to other families. The boy died 6 months later, during the 14th treatment, bled to death while leeches fed. But the father never blamed the physicians, never questioned the theory. He believed until the end that they'd done their best, that medicine had tried, that his son had simply been too sick to save. This is the power of belief, of wanting something to be true so badly that evidence doesn't matter. Medieval physicians wanted their theory to work, wanted to be able to cure madness, wanted to be heroes who saved minds as well as bodies. So they saw success where there was none, saw improvement in temporary fluctuations, saw cure in natural recovery, and when patients died, they saw tragedy, bad luck, severe disease, never malpractice. Never theoretical failure, never the possibility that they were wrong. But here's the really disturbing part. Some physicians knew, had to know, must have noticed the pattern, the high death rate, the low cure rate, the fact that most patients either died or stayed mad. They weren't stupid. They kept records, compared outcomes, discussed cases with colleagues. The evidence was there, right in front of them. Bloodletting didn't cure madness. It killed people, weakened them, made them sicker. But admitting that meant admitting their entire medical education was wrong, that the ancient Greeks were wrong, that centuries of practice were wrong, that they'd been harming people while claiming to heal them. That's a truth too heavy to carry, too dangerous to speak, too destabilizing to accept. So they didn't. They rationalized, found excuses, refined the theory, added complexity. Maybe it wasn't just about draining blood. Maybe it was about draining the right amount, from the right location, at the right time, with the right kind of leeches, in conjunction with the right diet, the right prayers, the right planetary alignment. The theory grew, became more elaborate, more specific, more unfalsifiable. Every failure spawned a new caveat, a new condition, a new exception. The core theory remained untouchable, sacred, beyond questioning, and the patients kept coming, kept suffering, kept dying. A woman who'd lost her mind after childbirth, a man who couldn't stop washing his hands, a child who refused to eat, a soldier who jumped at every sound, a widow who saw her dead husband everywhere, all of them diagnosed with humoral imbalance, all of them treated with bloodletting, all of them subjected to leeches, most of them dead within months, some from blood loss, some from infection, some from the underlying condition worsening without real treatment, but dead, gone. Lost to a medical system that claimed to heal but mostly just killed. There's a record from a London asylum, 1487. They treated 243 patients that year, for madness, for melancholy, for possession, For religious mania, every diagnosis reducing to the same cause, every treatment involving blood loss. Of those 243 patients, 17 were released as cured. 17. That's a 7% success rate. And of those 17, records show that 12 were readmitted within a year. Same symptoms, same diagnosis, same treatment, different outcome. 5 survived. 5 out of 243. A 2% success rate. And the physicians called this medicine, called this healing, called this progress. The death toll was staggering. Across Europe, across centuries, tens of thousands, maybe hundreds of thousands, people suffering from mental illness, brought to physicians, treated with bloodletting, dying from the treatment or the neglect that accompanied it, all because of a theory, a beautiful, logical, completely wrong theory that sounded scientific, that had institutional support, that was taught in universities and practiced in hospitals and defended by the best medical minds of the age. And when the theory finally fell apart, when germ theory and modern medicine replaced humoral theory, when psychiatry emerged as a separate field, when we realized mental illness had nothing to do with blood balance, the physicians who'd practiced bloodletting were already dead. The patients they'd killed were already buried. The evidence of failure was scattered across centuries. No single person to blame, no moment of reckoning, just a gradual shift, a slow realization. A quiet abandonment of practices that had killed more than they cured. History moved on. Medicine improved, the leeches were put away, and nobody was held accountable, nobody apologized, nobody mourned the thousands who died believing physicians could cure their madness if only they drained enough blood. So why did medieval doctors believe leeches could cure madness? Because they believed in the four humours, and the four humours explained everything: disease, health, temperament, madness. All of it reducible to blood, phlegm and bile, all of it treatable by restoring balance. All of it within medicine's power to fix if only the treatment was aggressive enough, bold enough, thorough enough. They believed because the theory was elegant, because it came from respected sources, because questioning it meant questioning everything they'd been taught, everything they'd practiced, everything they'd built their identities around. And that's too much to question, too much to abandon, too much to admit was wrong. So they kept bleeding, kept applying leeches, kept draining life from people who needed help, and they called it medicine. Called it healing, called it their sacred duty, believed they were heroes fighting disease, believed they were saving lives, believed they were serving humanity, never understanding, never accepting, never seeing the truth that was obvious to everyone else, that they were killers, that their theory was poison, that their medicine was murder dressed in authority and tradition. They died believing they were right. History knows different. The leeches fed, the patients died, the physicians slept soundly, and madness remained uncured, untreated, misunderstood for another 400 years, until real medicine, real psychiatry, real compassion finally replaced bloodletting with treatment that actually worked. But by then, the damage was done, the bodies buried, the horror forgotten. Just another chapter in medicine's long bloody history. Just another example of how good intentions and bad theories can combine to create unimaginable suffering. Just another reminder that confidence doesn't equal correctness, that education doesn't guarantee wisdom, that the healers can be the ones causing harm, and they'll never know it, never see it, never accept it. They'll just keep cutting, keep draining, keep believing, until someone stops them, until progress overtakes them, until history judges them for what they really were, not healers, just people, terrified people clinging to theories that made sense in their time, theories that gave them power and purpose and the illusion of control over forces they couldn't understand. And their patients paid for that illusion, paid in blood, paid in suffering, paid in life, while the physicians congratulated themselves on their knowledge, their skill, their commitment to the ancient wisdom, never knowing they were wrong, never suspecting they were the disease they claimed to cure. Medicine saved lives, but it destroyed much more first.